Well, thank you for spending your morning with us. This month is Endometriosis Awareness Month, and it gives women the chance to learn more about the condition and potential treatment options.
And joining us now is Dr. Gabrielle Whitmore with UC Health. You're a gynecologist specializing in endometriosis. Thank you so much for joining us.
Thank you for having me.
Of course.
So just kicking things off, what is endometriosis?
Great question. Not many people have even heard of endometriosis, let alone even know what it is. And so it's a condition where the lining of the uterus, we call the endometrium, actually goes backwards through the fallopian tube. At least that's the leading theory. And that lining can then implant on certain areas inside the abdomen, like the ovaries or underneath the uterus. And those areas can be really sources of pain for some patients. And so people can present with painful periods, and in extreme cases, pain with urination, pain with bowel movements, pain with intercourse, and some challenges with fertility.
I have known a handful of women impacted by this, and it's just a really all-encompassing pain sometimes, especially right around the period. Does it also impact fertility?
It absolutely can. So while a majority of patients with endometriosis can get pregnant, in the population that does have infertility, about 38% can have endometriosis, unfortunately.
Wow. So, obviously this is something that does impact, a lot of women, and, women may want to have kids. What are the treatment options and things like that? Even if a woman doesn't want to have kids, they just want to, suppress the pain.
Totally. And so I think the biggest thing is it's not a one-size-fits-all mentality. You really want to work with your healthcare professional to find a treatment that works best for you and your goals, like you said, if you really are not interested in starting a family. So one is really working on the inflammation that endometriosis can create, and so starting with anti-inflammatories. The mainstay treatment is hormones, and so really either estrogen, progesterone combinations or progesterone alone, really to minimize that blood going backwards and creating more endometriosis. But for some patients it means surgery, right? And so where we go in and do a procedure as minimally invasively as we can to remove as much of endometriosis as we can safely.
And once you all do that procedure, what does it look like, moving forward? What does the recovery look like, and what does the procedure do exactly?
Yeah, so it totally depends on the type of endometriosis one can have, and again, your goals. But we try to do it minimally invasively, so with a procedure called laparoscopy or with the robot. And a lot of times people can go home same day, minimal risk of infection, minimal pain, right? Because that's one of the things we're trying to really avoid. And so some people can be up and moving literally that same day, going home and moving and being with their families and feeling a little bit more like themselves the next day. The long-term kind of projection, though, really depends on how bad it is. Sometimes you have to stay on hormones. Sometimes, really is working with your team to figure out what other sources of pain are there that we really need to manage.
And for any women perhaps watching at home, are there any warning signs or things where you recommend that they do see a doctor and see if it is endometriosis?
Yeah, so I think the biggest thing is if you have painful periods and you're missing school, missing work, that's not normal. We have to stop normalizing this pain. Really speak to your friends, your family. They may have endometriosis or be aware of it, and really finding a provider you trust to start exploring if you have that diagnosis.
Yeah. Well, thank you so much for coming and having this conversation. Absolutely. It's not something we talk about a lot, but certainly wanted to bring awareness to it this morning, so thank you.
Thank you.